A pleasure to be here today with Dr. Samir Parikh. Sir, welcome to the Kolkata Literature Festival. Let's talk about your session first. It's called The Theatre of the Mind, very intriguingly titled. What are you looking forward to discussing and what are you anticipating from the session?
To be honest, being here in the Lit Fest and the sheer energy and the length and breadth of it is quite impressive. Um, if you ask me, then the fact that we are talking about mental health in a literature festival, I think that in itself is a very important thing because mental health is the elephant in the room. We don't address it. The fact that we'll talk about it, people will hear about it, which means we raise the bar of awareness, break a few stigmas, may people get more open to talking about it, make uh, destigmatize society when it comes to mental health, prioritize mental health, put it in the right place that it deserves to be. I think that's a step forward.
Talking about mental health, especially after the pandemic, there actually has been a lot of discussion, at least in sort of urban elite circles. So, do you think that in some ways the stigma around mental health is dissolving? Or do you feel that no, we're just scratching the surface? There's a lot more to be done in terms of recognizing the real importance of mental health?
Two aspects to this. Even if we keep the pandemic aside, so what I've been 20 plus years into practicing, you add my education, that's 25 years. So, of course, in the last 25 years, I have seen the stigma diluting, more people talking about it. Having said that, globally 70% plus people do not seek help because they fear they're being discriminated against and the stigma. So, even though we are moving forward, there is a big way to go ahead. Pandemic, yes, more conversations happen because almost the entire world experienced distress at a simultaneous time and talked about it. At a more clinical level, WHO in 2022 talked about a 25% increase in depression and anxiety globally. So, yes, more conversations have happened, but it's a long way to go.
In terms of changing the narrative about mental health, do you think that as a culture and as a system, as a social system, we need to incentivize paying more attention to mental health? For example, today, if let's say I'm working at a company and I have a fever, my boss has an active interest in making sure I recover quickly so that I can come back to work. But if I'm in depression, doesn't quite happen the same way. So do you think as a system, as a culture, we need to do more?
Yes, I mean, it's very interesting that what you say. I was recently speaking on workplace mental health, and I was saying exactly this that forget what you understand about mental health. The sheer economic cost of mental health runs into a few trillion dollars in a year. Why? Because you're quite right. So when somebody is going through, let's say, depression or an anxiety, how many days of work, how much productivity, and then the cycle of the individual, their family, and the impact, we don't realize it. So early intervention can make a huge difference. How will that happen? If you seek help early enough. How will that happen? If you're comfortable doing that and you don't fear what will people think. So you can go to your boss and say, hey, I had migraine. Would you be able to say, hey, I had depression? That's where we need to bring a change. I think it's not merely about the incentive. I think it's realizing the incentive. The incentive for the self, you lead a better quality life. The incentive for people around you, your relationships are better. The incentive for workplace, your productivity will be better. The incentive for the large society, quality of life will be better. That's mental health.
Wonderful. Final question, since we are at a literary festival, what role do you think literature or the arts in general has towards promoting mental health, making people more sensitized towards it?
Two sides to this. One, I would say portrayal of mental health. I think all forms of art need to be very sensitive and careful when they portray mental health and ensure that they don't fall prey to the stigma. So, for example, mental health for comedy or mental health to showcase crime or psychopathy. Be careful about this. Avoid it. Use the right terms, right words, empathy, sensitivity. I think that's important. That's one part of it. The other part is we need a lot more literature related to and on mental health in India. We need a lot many more people to write on mental health in our country so that the cultural aspect of any society plays a big part in the mental health also. So what may apply a few thousand miles away in some other country or some other culture may not always apply in another country in the same way. So I feel more and more literature needs to come, and I think it needs to come from across the age group, whether it's literature for children, for parents, for young adults, for senior citizens. At various levels, we need a lot more of literature in mental health.
Wonderful. Thank you so much, sir. Hope you have a lovely time at KLF.
Thank you. Pleasure.